Hello and welcome to How to Deal When the Shit Gets Real podcast. I'm Rietta, and today I'm joined by Danielle. And I'm just going to say Danielle because I'm not going to mess up your last name. I'm not even going to let it go out there. But anyway, so Danielle, tell us, how do you
Yeah.
deal when the shit gets real? Or just tell us a little bit about yourself.
Yeah. So I'll give a little bit of background first. You say my last name Kepics, Danielle Kepics. So I
See,
grew up
I
in
leave
Ohio.
it to you, the expert.
Yeah. Yeah. I grew up in Ohio. I live in southern Utah now with my boyfriend and my two dogs. I'm a physician assistant by trade. I own my own business. We were bonding over your book collection back there that I'm sure your listeners are like really familiar with. I love to escape into fantasy world because like gestures to the world around us, like what a dumpster fire that we live in. Um, not and therapy is also important. I don't want to say like just escape into like fantasy land. I was a therapist before I was a PA, so I have a lot of respect for like good mental health and good mental health care. Um, but yeah, that's a little bit about me. I love the outdoors. I love reading, like I mentioned. I've been a total gym rat since about the age of 12. So I love to lift and lift heavy. And I was a competitive CrossFit athlete for a while. I've ran half marathons. I've done a little bit of everything. So exercise is also a huge component of like coping, although we can talk about how that can get ugly for people because I feel really, really strongly that like exercise is not therapy. And I have a lot of thoughts about that if you want to hear them, but I'm happy to answer, talk about anything and any questions that you have. I've had a really interesting life, I feel like. I mean, I think a lot of people have if you listen to their stories.
Yeah.
But yeah, I mean, I grew up like have you ever read Brene Brown? I'll just take over your podcast and ask you questions.
I mean, that's fine. Yes, I have.
Yeah. So in one of her books, I think it was it's the one with the blue cover, and this is where perimenopause and like where's Waldo for words come in. I think
Uh-huh.
it was
I'm
Rising
there with you.
Strong. Yeah. And she told a story about how she tried out for like it's not the cheer squad, but it's like some kind of dance thing, and she didn't make the team, and her parents just like really brushed it off, and she was so brokenhearted. And she said that was the first time that she realized that she didn't belong in her family. And I feel like from a very young age, I knew that I didn't belong in my family. I'm talking like 5, 6, 7 years old. Like I just
Oh,
felt like displaced. I'm an only child too, so
me
like
too.
only children unite. We are the best. Like I just yes. So, but like figuring out on your own, like not having like an older sibling or even just another sibling to kind of be like, I'm not crazy, right? Like our dad's a fucking lunatic. You don't have that sounding board, and so anyways, like fast forward, my mom was diagnosed with cancer when I was 12. She died when I was 16. My father is a complete and not, I think the word narcissist is thrown around like very willy-nilly these days. But I mean, like the screaming and gaslighting in my household was really, really disgusting for lack of better words. And so and then I moved on to college and other things, and I know there's like a lot of questions that you want me to ask, but that's kind of like the general background. And I was actually it's funny, I was talking to my best friend and my business manager, and I'm like, you know what, like no one's ever given me a damn thing, and I've always like found a way to figure it out in my life. So I feel like that's a really good for like the topic. It's funny, I usually am like talking about like expert matters of like perimenopause and things like that, so like going to like shifting gears and talking about this is really different. But we were literally just talking about that, and I was like, I will always find a way to like scrappy do my way in.
I love that though. I
Yeah.
love that. I mean, we can talk about perimenopause too, because hello, I'm there, I'm 40. But I would love to backtrack actually to what you mentioned about exercise, because I
Mhm.
have been an avid athlete my whole life. I have my degrees in kinesiology, exercise science.
Oh,
So
cool.
I'm there with you. Always been an avid exerciser. And to me, it does keep me sane. Like it is
Totally.
a form of therapy for me. So like I'd love
Totally.
you to elaborate on why you feel
Yeah.
it necessarily isn't a form of therapy.
So let me back up and say that we do have studies that show that appropriate exercise, and appropriate I think is the word that I want to fixate on here. Appropriate exercise does more for our mental health than medication or therapy. Like we have those studies that show that's 150 times more effective. However, the word appropriate is important here, because when you see things like, I put this together a long time ago. I had this friend who did a lot of Ironmans, and she's no longer a part of my life, but circa like 2009, I was just like, what are all these endurance people doing? And I've ran half marathons and other things too, but I've just really started to notice this trend of unhealed trauma and people who chase endurance events. So I'm talking like 2-3 marathons, 2-3 Ironmen in a year. Like there is a point where it becomes counterproductive. So like when we talk about, I'll bring in my background as like a physician assistant, and I work in functional medicine. I own my own business. Health and performance are on a spectrum. And when you slide too far over to performance, you start to compromise health, right? So like we can talk about like certain professional athletes and how they die younger because of like head injury or this or that, or because of what they do to their bodies, etc. When you look at what someone is doing to their body and beating it down and how they feel to a extreme, you're compromising health, physical and mental at that point. And there is a point where, like I joked about like dissociating into fantasy books, right? Like there's a point where anything can become, pathologic is not the word I want to use, but
Obsession?
Yes, like just detrimental instead of being helpful to somebody, right? And so when exercise is used appropriately and safely and at the appropriate doses, and people are fueling themselves and recovering appropriately, 100,000, 1,000,000%, I'm a huge advocate. I just see it abused a lot. And listen, I work with a very specific population of women who have been over-exercising and under-eating for a long time. So I see it. I see a lot of it, and I've seen it a lot in the endurance community. I don't know where the stress fracture came from, the autoimmune disease, the this and the that. And it's like, well, you've not sat down in 20 years. Like you're raising 2 kids and you're trying to run 2 marathons and run 80 miles in a week and have a career and climb the corporate ladder. And I always say it's like you got to look at your stress bucket and see what you have available to give to exercise, because it is a stressor on the body. It's a great stressor. It helps, your immune system, your stress resilience, reduce cancer risk. I mean, we could talk about the benefits of exercise all day long.
Right.
But I think it's just important for people to realize that you need to put it in appropriate dosing, and also look at the season of life that you're in, because appropriate changes based on season and how much stress and things that you have, and not to like just use that, right? And so it shouldn't be used as a dissociative tool.
No, and that makes sense. I mean,
Yeah.
we shouldn't really be using anything, right, as a
Correct.
dissociative tool.
I mean, listen, TV, scrolling on the internet, like it, you name it, it all has the health, what outcomes come from it. Just like you're not going to get a stress fracture from like Netflix and chill. You know what I mean?
If you do, we have questions.
I don't know, in your thumb, but you know what I mean? Like the negative outcome changes based on the dissociation or the tool that you choose to abuse, right? So those are my thoughts. Yeah.
No, I love that. And I think it should be talked about more, because, it's always just exercise, exercise, exercise. You'll feel good. And we don't always talk about both sides of the sword.
Yeah. And like I said, I've been a gym rat since I've been 30, and there have definitely been periods in my life looking back that I have 100% done that. So I am not speaking from like a high horse of like, oh, like pointing fingers. Like I've been there too. I get it. And, was it better than me like turning to drugs or something else? Like probably, but at some point where it's just, the osteoporosis, like, I mean, let's stay on the endurance athlete train. Like I know I sound like a freaking hater here, but a lot of endurance athletes end up with osteoporosis because they don't strength train and they undereat. If you suffer from a hip fracture after the age of 65, you have 1 in 4 chance of dying from a complication. So like the risks are real. They're out there. So
yeah, absolutely.
Yeah.
And then you also mentioned that you unfortunately lost your mom at a very young age. How did you deal with such a profound loss?
So it's funny, not funny, haha, but I have a friend who recently lost her mom to a heart attack very suddenly, and there's been a lot of complications with that death. I was literally just talking about this to someone else too. And I said, you know what? I think it was easier for me to go through that as a child, because like you still see I know you can like argue on all of the sides, but she's going through so much complicated stuff because, she's an adult now and she has to deal with all the adult things related to her, the death of a parent. Right. And so I think partially for me, when you're a kid, you just don't have the frontal lobe development. So I think that was I don't know, like, I don't want to say it was a blessing. That's like that sounds so awful. Like losing a parent is so horrible. But I think one of the things for a more constructive conversation, one of the things that really got me through is I always looked for an adult to kind of help me guide my way. Like I was always reaching out to people. I never secluded myself. Like I really, even my friends at such a young age, like I was always like making sure that I was with people and I had people to talk to and I had a positive adult influence in my life. And I really think that that saved me, because I've talked to like social workers and psychiatrists and things about this, is it's like, what do you think that it factor is that like makes somebody go the direction that I did versus like, the drugs and alcohol or whatever, like negative thing that we want to talk about. Right. So, and I think that that's just been a constant through my life. Like when things get hard, like I have always managed to surround myself with really amazing people. And I think, I mentioned my sperm donor father. Just when you can cut off a blood relative, like you don't take a lot of crap from other people in your life, and you also learn and understand how to filter people into your life that are only going to add positive things. And I think that has really, again, like having a narcissistic asshole father, like not fun, but like blessing in disguise, because I have created a really amazing community of people in my life. And there's people who have like filtered in and out. And I think that's a natural ebb and flow. And, I've had really beautiful people in my life at varying stages. And I've had people who have been around for a long time. And so I think that, loneliness can be, it's an epidemic, right? Like we have statistics on this, like from a health perspective. I think that is the one thing that has really helped me pull up my bootstraps. I would say exercise too, right? I was an athlete my whole life, so I had that to focus on. I had goals.
So it's almost kind of like you lost both parents.
Oh yeah. I did not want to be around my house as a child. Like I spent as much time as I could away. When I went off to college, I was like the last person to leave the dorms and the last person to like the first person to come back, like on Christmas breaks and stuff like that, But yeah, it is a lot. Like I did a lot of raising myself, or like I just mentioned, like having other really positive influences in my life, like, teachers, other adults, coaches, friends. A lot of my friends' parents were really my parents, and even if it was just, not for that long of time. Like I played travel softball and I saw that one of my girlfriends, her mom died recently. And I really like, Cindy was like really amazing to me. Her mom was just like really, really incredible and such a good human. And like, I was only really deeply involved with them for a couple of years, but like I felt that, and that stuff was, those people were so important for like me becoming who I am and not going the other way.
Yeah, it's important who we surround ourselves with, and I agree with you that it ebbs and flows, because I've had great people in my life at different points, and some are the same and some aren't, and that's just kind of the natural progression of things.
Yeah.
But you also talked about your medical career, and
Yeah.
you did start off in more of a conventional medicine, and then you started your own practice. So what inspired you to do that?
Oh, yeah. So, I started to notice that women weren't being served the way that they needed to. I don't know what your experience has been with the healthcare system. And I would like to preface this by saying, like, conventional medicine has a lot of upsides and functional medicine has a lot of upsides, and conventional medicine has a lot of downsides, and so does functional medicine. And I like to say that I blend the best of both. And so the internet came around and I started finding like a lot of women naturopathic physicians, or just medical doctors who thought differently. And I was like, man, like what they're saying like makes a lot of sense. Like, no one ever taught me that no one ever said like in these terms, like birth control shuts down your cycle when I was in PA school. Right. And that's not a knock to my PA program. That's not a knock to the career of physician assistants or anything. But I was like, man, if I really didn't realize that it's literally shutting down all of your hormones, like how many other women didn't realize this, right? And I was like, I literally heard somebody say one time, like, would we ever shut off a man's testosterone? I was like, no, like we would never, in my opinion, like you would never see a drug that did that. that was for something optional, like birth control, right? Like it's not life sustaining, right? Like there's hormone modulating drugs for like different types of quote unquote like hormone fed cancers for men and things that's a whole other discussion. But I really, I did travel PA work for a little while, and I started to realize that, once I got into a permanent position, I was like, man, like women are really getting brushed off. Like they're told their labs are normal. They're told they're just a mom. It's just stress. It's just anxiety. Just take birth control. Just take Miralax. A lot of justs, and so, my I host a podcast as well that was born out of, it was what I call a pandemic baby. And once that started, it was kind of like a downhill spiral. And I was like, I can't stay here. Like I can't stay in a system that's just trying to put a square hole in a round peg kind of situation. And so I decided this will be the end of it. I one day walked into work and I had gone and got a fertility education certification, which the place I was working at the time paid for as part of my CME. And then when I wanted to do something with it, they didn't like that idea. And they didn't like the things that they went and looked at my Instagram account, which like, go for it. And they were like, we don't like the way you talk about gynecologists. And I was like, what's your point? Because when I am no longer having to fix their mistakes or their misdiagnoses or the things that they shrug off for women, I mean, the things that I could tell you that women have been told is just like, I mean, I have a patient now who was told by a doctor that perimenopause is a fad and you should run from anyone that says that word. Like, I mean, just such outrageous things that women are told. I'm like, it's literally like, did you skip physiology class? Because this is a 10 to 15 year neuroendocrine transition, right? And so I walked out of work that day.
Any woman over 40 that is sweating and has brain fog and doesn't understand what's happening, that perimenopause is just a fad. Because yeah. How else do you explain that?
Yeah. It's in your head. And so totally. I decided that day that I would leave, and it was less than a year later I was out, because I was like, I cannot stay in a space where my integrity is not intact. Like I was so disconnected, and there's another D word that I'm looking for, but again, where's Waldo for words?
See?
Oh my God.
But perimenopause doesn't exist, but you just can't find your words.
Yeah, listen, and I'm on hormones. Like, what are we doing here? But yeah, I'm a big action taker. Like I will not sit in a situation that does not feel good to me. I will find a way to move out of it. And so less than a year later, I did that. It was great.
I love it. Yeah. And that actually brings me to a question that I was just talking to my girlfriend about last night, and I would love to hear the answer from you, because I know it's kind of gone back and forth. And I remember it very vividly happening to my grandma, that there was a study that came out that said being on hormone replacement increased your chance of breast cancer.
Yeah.
And I remember my grandma had been on it forever, and they were like, we're just going to cut you off cold turkey. And then guess what? She ended up with a heart arrhythmia. So it's like, is that actually a valid thing? Like,
no.
Is HRT causing breast cancer?
No. So the WHI trial of 2002, this Women's Health Initiative is the study. And we actually have studies now that followed those women until today. And we now have retrospective data that shows that there have been in the hundreds of thousands, so like 100,000 plus women died unnecessarily because we denied them hormone replacement therapy. There is no connection to breast cancer and hormone replacement therapy. If anything, it was the progestins in those trials that caused problems. So when we look at hormone replacement therapy, progestins is like the synthetic of what's in a birth control pill or like a Depo shot or something like that. Progesterone is what your body makes. They are not the same thing. And there's a lot of misconception there. And so, yeah, this is definitely not the same thing. And I would say that most women, even if they've had a past history of breast or GYN cancer, are still candidates for a lot of types of hormone replacement therapy. You just have to find a practitioner who knows what they're doing. So if that's you, know that there are options out there for you. I feel really strongly about that.
I figured you'd have a good answer to that. And yeah, it's still talked about so much, even though, like you said, that study is from 2002. It's a very old study. And like I said, I just talked to my girlfriend about it yesterday, because she's I'm on HRT, and she decided to take a different route. I think she's actually trying a GLP-1 to handle premenopause symptoms. So we were talking about like the differences, and she's like, "No, I can't take hormone replacements because breast cancer runs in my family." And I'm like, "I think you need to reevaluate that."
Yeah. So it's just not true. So
well, thank you for
yeah,
solidifying that, because it is still a
yeah.
debate that's happening among women
I know.
right now. And of course, it scares women because nobody wants breast
Yes,
cancer.
I totally understand. And like my mother died of breast cancer, to be very clear. So I've been tested for all the genes and things like that. And like I think knowing your risk and all medications have risk, right? Like we're not without
Absolutely.
that. But if you work with the right practitioner and you want to do hormones, I'm not, I would never push anything on anybody. But if you're curious about it, like it is worth a discussion. And it's just really hard to find a practitioner who understands what's going on or is willing to work with your oncologist if you're in cancer recovery and things like that.
Yeah, absolutely. I mean,
Yeah.
I've only been on HRT, which is hormone replacement therapy for anybody who might be confused, since March, and I've already noticed a huge difference.
Yeah.
So
Oh,
if you're
so great.
struggling, talk to somebody.
100%.
Don't sweat alone.
Literally, or at all.
Or at all, yes. Oh, I love this. I love when like things just align. Like I just happened to talk to somebody about that yesterday, and then you brought it up today. Like
Yeah.
that conversation was meant to happen. I love that.
Yeah. So important.
I'm gonna bounce back to you talking about estrangement, because I think that's still a really important topic, and people don't talk about it enough because there's still that old saying, blood is thicker than water, which actually isn't even the correct saying, but we're not going to dive down into that rabbit hole. But talking about like how estrangement actually can be a good thing. So like what personally would you give, advice to people that are maybe feeling estranged or maybe think they should cut off somebody in their family?
Yeah.
Whatever line you want to take with that.
Yeah, I mean, I think first of all that like the decision is not right for everyone, and I'm not here to tell anybody like you should never talk to your parent or family member or whoever again, or you should try to repair. Like I don't live in your life. I don't understand what's going on in your relationships. And also, I just want to give anyone the permission who really feels like they have a toxic relationship with I can speak like to a parent. And that's, I think a lot of the family estrangement that is talked about is with the boomer parents specifically. And there's, I mean, that's like a whole other conversation, but like, I just want to give you the permission to say that like, it's okay. Like if your relationship really is that toxic and it is causing that much harm to you, like, I don't care who that person is, they don't deserve that kind of access to you if they're just continually and repetitively hurting you and they're showing no effort to create change. Right. And so for me, like, I remember I told this story to I think a therapist I had once where I was 16 years old. So I had a driver's license and I knew my father had a doctor's appointment with our PCP. So like general practitioner, primary care physician, whatever. And so I scheduled an appointment at the same time. And this was after my mom died. And I snuck in and I checked in before him. And I said, the doctor needs to see me first before my dad. And they literally put us in rooms next to each other. And I could hear like what was going on. And I was like, he's drinking too much. He's yelling at me all the time. Like just telling him all of these things that are like going wrong. Like he's not coming home at night. And like, I'm worried he's in the hospital. Like something's going on. And like 16 years old. Like,
yeah. and you're being the responsible one.
What are we doing, you guys? What the fuck are we doing? Oh, and so anyways, nothing happened after that. Like I heard him go in after me and like I could hear the conversation and nothing was brought up. No questions happened. And as a physician,
that's alarming.
You are mandated to, I mean, I wasn't technically being abused, right? But like you're mandated to keep safety for people. And like you have a child telling you that they're worried about their alcoholic parent and you do nothing, like shame on you. Shame on you, because like if that were to happen to me as a licensed medical provider, which I'm a mandated reporter in all 50 states, right? There's no way I'm not doing something about that. there's no way I'm not confronting that adult for that child. How dare you?
Right.
So like, not only did my mother die, and when she was alive, she like wasn't getting between my father yelling at me. So like, she wasn't sticking up for me, and like, you know, she had her own shit going on, not to like make excuses, but like, just it is what it is, right? My father clearly wasn't. Like, what the fuck was he doing? And then this physician also fails me. So, you know, looking back, I was just like, man, that was really, really messed up. And so getting back to what you're saying about like, what would you tell people if they're thinking about estrangement? You know, that was the first straw where like I was trying to get my father to talk to people. I was trying to get people who were my mom's friends, like, can you talk to him? No one would do anything for me. And I was just like fucking begging people. I was like, please help me. Or maybe they were and I didn't know about it and I didn't see it and it like wasn't, you know, it wasn't going well. I'm sure my father wasn't very receptive to, hey, your daughter says you have a drinking problem. You know what I mean? So there were multiple times in my life where I tried to like say, hey, will you go to therapy? I think you need to go to therapy. There's nothing wrong with me. There's you go to therapy, you know, just like all the screaming and yelling. I mean, like to put it in check for people, like I remember being like 14 and spilling a glass of water on our like vinyl kitchen floor and him screaming about the spilled water for 3 hours. This is how fucking crazy the man was. Like, that's not normal, right? And the typical, I feel like, boomer, like, I put a roof over your head and I do all these things. I'm sorry, did I ask to come into this world? No, your sperm, her egg. I had no say in the matter.
I had no say in this. Yeah.
No, none. And so, you know, and it was always like the same thing over and over. And, you know, I mean, I remember being 28 and my father saying that I should be living at home taking care of him instead of like living with my boyfriend at the time. Like,
I'm not your wife. I'm sorry.
Crazy. Like just really like, again, going back to the Brene Brown story of like, I knew I didn't fit in my family, right? Like this is so deranged, and he had issues from his childhood that he never dealt with, not an excuse. And so it's just like, you know, we had periods through my adulthood too of like 1 to 2 years where we didn't talk because I was like, I would literally hang up the phone and he would be screaming. I don't even know about what anymore. Like, I think I've blacked it out. And I'm like, when you're ready to talk to me and not yell, you can call me back. And he just wouldn't for like 2 years. And I don't remember exactly like how we like reconnected or whatever, but I haven't talked to him since 2019 and I really don't. I mean, are you dead or alive? I don't know. And that was like really so this is actually pertinent, is one of the ways that I made peace with like the decision was, if you got a phone call tomorrow that he was dead, how would you feel about not speaking with him? And I was like, I'm good. And I realized that is not for everybody. I understand that.
Mm-hmm.
But for me, that was really a really helpful thing in the decision-making process. Where I was like, if you get that phone call at 3 a.m., how are you going to feel about it? How are you going to feel about yourself and the decisions that you made and the effort that you made and the choices that you made through this process? And I was like, I'm good. Yep. And that was when I knew that I was really doing the right things for myself in that situation. And yeah, I mean, like, I don't really have a ton of other family. Like, and he really, my mom's sisters, he kept me from them from reaching out. And the only living sister that I talked to, she literally said, I'm so sorry I didn't try harder. I was the adult. Like, your father kept me from you. And that is the reason I have a relationship with that aunt today, because I was like, fucking good on you for taking responsibility. That's all it took. I'm not someone who expects like, oh my God, let me plead and beg. However, because I grew up in a home where it was screaming for 3 days and then like acting like nothing went on, there was no acknowledgement. No, I'm sorry. Oh my God, I was wrong. Like, that meant everything to me for her to say like, listen, I am so sorry. And this was 2020 that this happened. She found me through my podcast.
Oh, I love that.
Yeah, like she was literally searching for me and found me through my podcast. And she's like, I'm so sorry. I wish I would have tried harder. And I'm really sorry. I was the adult. And that it went a long way for me. But yeah, I'm not telling you to be like, think about if your parent was dead, how would you feel about it? But I'm kind of saying like, I don't know. I think it's a good litmus test.
No, it is, and I absolutely went through the
Sounds
same
so
thing
awful.
with my aunt, because I remember when she was very ill, and I remember when she was getting ready to pass, my mom was like, "You really need to make up with her," and I was like, "Why?" And
Yeah.
she's like, "Well, she's gonna die. You don't wanna, have her die and then you never work it out." I'm like, "I'm good.
Yeah. Like I'm
I'm
real good.
good."
I don't
Obviously, I
Is
don't
she
wish
okay?
death
Like, you know
obviously,
what
I
I mean?
don't wish death upon her, but I'm good.
But here's the thing too is like, was your mom ever saying to your aunt, like, maybe you want to fix things with my daughter? Like,
Also that.
does that ever I feel like the kids in the situation or the younger party, right? Like it's just easy for me to talk about my own situation. It's always, but they're your parent. And it's never like, okay, like why aren't we asking about this like why aren't we sitting back and thinking like what's causing this child to cut off ties with the person who is supposed to be the most biologically safe from an evolutionary perspective, the most biologically safe person in this person's life? What is making that child not want to have a relationship with that person? Why is that
Right.
question not being asked? And like, oh, they're your parent, don't you care? Why is that how the conversation goes? Why do like I was the one who, listen, I'm not perfect. I'm sure there were things that I also did wrong. But listen, I did my part to try to rectify and got fucking therapized out the yin yang. And I feel like our generation has worked so hard at that. And
Mhm.
these boomers are just out there like, I put a roof over your head. You should worship the ground I walk on. And the end of the conversation. And I'm just like, that ain't, no, dog, no.
No, that's not how this works. That's not how any of this
Yeah.
works.
Yeah. Like, oh, you did the bare minimum? You clothed me? You fed me? God bless you. Like, let me give you parent of the year. And I mean, listen, I joke and kid, but I really do think that, why aren't we asking that? Like, why is no one ever asking my dad, like, what did you do that made your child not want to have a relationship with you? I guarantee you no one's ever asked him that question.
Well, and another question too, which I question this on the regular with social media and stuff in general. Um, why are we not intervening? Like, why wasn't your physician intervening? Why didn't somebody else in the family intervene? Why are we posting things on Facebook that's like, somebody's kid was out running around and breaking windows? Why didn't you go up to that child and be like, hey, what's going on? Why are we breaking windows? Where are your mom and dad? Like, why are we posting to Facebook and taking the passive aggressive way out? Like, why is nobody intervening anymore? Like, what is happening?
I don't know. I mean, and back, when I was 16, social media didn't exist, to be very clear. Like we had AIM, okay? Like we
Yeah,
had we had
yeah,
away messages.
and
Like
MySpace.
yeah, yeah, Tom, where's Tom? Like he could save us all right now. So I don't know. Like I think that now it's it's so much easier for us to be at a 10-foot pole and not be involved, right? Of just like I think social media is a big part of that, right? Like
Mhm.
there's the lack of human connection has dehumanized us, which, when we become dehumanized, we don't care as much, I think is a huge part of it. Um, I don't
But,
know.
like,
I
the
wish I knew the
doctor
answer.
that
Yeah.
you saw
Yeah.
is literally a physician that's taking
Yeah.
care of people.
Yeah. I don't.
Your whole purpose is to take care of people, and
So
you're not gonna be like, maybe
here's
I should call and be like, this 16-year-old, because at the worst case, even if you were lying, let's say, right, or making
right.
it up, you still took the precautions to find out what was actually happening, because God forbid if something happened to you and he didn't do anything.
Hmm. Yeah, we call that a type 1 and a type 2 error in like the statistics world, right? So it's better to like let a guilty person go than convict an innocent man and put him in the electric chair kind of thing. Um, I don't know why that stuck with me all these years through the statistics class, but it did 20 something years later. I don't know. And, the answer that comes to my head is that not a lot of people are excellent at what they do. And, the bell curve applies to everything. And so you get about 10 to 15% of people who are really excellent and really love what they do, right? So like when you get a Venn diagram crossover of someone who loves what they do and who's really excellent at it, it's such a small percentage of people. I don't care if you're a Navy SEAL, a teacher, or a doctor, right? And so like, was he just there for a paycheck? Did he actually give a shit? Did he have an awful day? Like it could be so many things, right? Like just going back to my specific instance. And I think now it's just people are so overloaded with information. And why are people so overloaded with information? Because their brains are like scrolling everything like they do, like they scroll Instagram, right? So I think that everybody just feels so overwhelmed and overworked and overburdened and overstressed, and everybody's just depleted and dysregulated, and they're running on fumes, right? Like back to the beginning of this discussion. And so they're just like, it's not directly affecting me. That's a shitty answer. I realize that. And it's not
But it's a factual answer,
truth.
even if it is shitty. Yeah.
Facts don't care about your feelings. I don't know what to tell y'all. I don't make the rules. I also would like to speak to a manager about a lot of things, but like, you know, so I don't know, man. Like I tried so desperately to get help of an adult, and it was just like, I had a couple adults who I know did what they could.
Mhm.
And, like are a huge reason as to like why I am who I am today, and like that I didn't, I think, go down the pooper. But, you know, my father was known for like, oh, but he's so nice. And meanwhile, I'm 10 years old being screamed at for my performance as a 10-year-old in softball. Screamed bloody murder. And I'm like, this is like, I'm 10. You know, looking back at this, and like I was just begging for somebody to come and save me, and it was just like no one would believe me. And I'm like I don't know, maybe that's why, like, I guess when I saw teenagers and kids, like if they said things about their parents, I just, even if it wasn't like they were just upset with their parent, right? Like normal teenage parent shit, like I'm like, you know what? I'm really busy, but I'm just going to sit here and listen for 5 minutes. Because like no one even did that for me. You know what? I like very few people did that for me. And I think that things like that just go a long way, you know?
They do. They do.
So,
all right. What is any final advice, recommendations, whatever you want to do to give my listeners before we say goodbye for the day?
I think giving yourself permission to do whatever you need to do to be happy and healthy in your life. Like you don't live your life with anyone every single moment of every single day besides anyone but yourself. And so you have to live with the decisions that you make, but you also have to live with the decisions that you make or the decisions that you don't make, right? And so I also think, like, don't complain about what you tolerate. Like, I didn't want to be treated that way, and I didn't want to be in that relationship, and so I'm not tolerating it. And yeah, if no one ever gave you the permission, if anyone has ever just said like, oh, you need to fix your relationship, you need this, like, you don't have to do anything. No one's forcing you, and you're an adult, and you can make the decisions that you want.
All good reminders, because
yeah,
I think a lot of us tolerate more than we should.
Amen.
Thank you so much for being here, Danielle.
Thank you so much.
And this is how to deal when the shit gets real, guys. I will see you all next episode.